Welcome back to our channel, A&E Family Farm. I'm Amber, and I want to come on here to talk to y'all about something that can be life-threatening and serious in your goat herd. So, bottle jaw. What is bottle jaw? So yesterday evening, I noticed this little doe here. You see her jaw, the bottom of her jaw. Bottle jaw is accumulation of edema or fluid underneath the chin area of your goat, and it is caused from edema, anemia in your goat, and it is low protein in your goat's blood and anemia. And so the most common cause of this is a parasite load or the barber pole worm. So I got her immediately. I checked her FAMACHA score, and she had a serious life-threatening FAMACHA score. So I separated her off. I have her in a little stall in the barn, and I immediately started an anemia protocol on her. I gave her valbacin and cydectin wormer, and also a shot of a vitamin B complex. And she will also be getting a copper bolus, and we will be giving her extra protein, some alfalfa, and we also feed sea kelp. And I know that we have been out of sea kelp for a little while, and we are really a proponent of sea kelp. It really helps your goats. It helps with their immunity, and it helps with just their overall coat and conditioning. And they love it, and they scarf it down, and it's expensive. There's nowhere around here that actually carries it as far as a feed store, so we have to order it, and it takes a little bit to come in, and it's about $80 something, almost 90. It's went up now, almost $90 a bag for that. And they do love it, and they will scarf it down. So, but we really do think that it improves your goat overall. And we also have a good loose mineral out for them and a sulfur block. So that is the classic sign of anemia is bottle jaw. So I wanted to come on here and share that with y'all. Signs and symptoms to look out for in your goat. So she's doing fine. You can see she's a little skinnier than the rest of the other does. And I also moved this one in here as well. I checked her FAMACHA, so I'm just going to give them some extra nutrition. And I'm also going to move our little buddy out today with the other little kids. I think he's strong enough now. We've had him in here a week now, and he seems to be progressing pretty good. Is he 100%? No. I feel like he probably did have pneumonia with, we gave him a couple of rounds of the LA 200, and he seemed to get better from that. So I think he probably did have worm issues and then got a secondary pneumonia infection. Hey, buddy. Say hi, buddy. Say, I'm getting better. I really thought, like I said, that he was not going to make it through the night a couple of nights when he could not even stand, and he was rattling so bad when he was breathing. But, yep, that's what bottle jaw looks like in goats. And we have wormed her and we're treating them, so hopefully she'll get better. You know, it's one thing to lose a little buckling versus a doeling that is potential to multiply and give you offspring and improve your herd. So I got her a little buddy in here with her. She is also going to be treated. I checked her and she has not as bad a FOMACHA score, but she will be getting treated also. It's just been a terrible spring, summer for us here, and we've had parasites, especially in the little kids. I've only had to worm one of our other does, which is this little kid's mother. The rest, they've done fine. They're not having any issues. So it's been really hard on the little kids not to pick up parasite load. So, you know, if it wasn't for bad luck, we wouldn't have any luck at all. So it seems to be that way around here. Tell you another little story. So the reason I had valbasin to treat this little kid is because, you know, as all of you probably have been too, looking for valbasin in the stores all around, and it's back ordered everywhere and you can't get it. But so Saturday morning we went out to feed our little pups, and we were doing our morning rounds feeding, and one of the little pups was sitting there, and I looked at her and I said, her jaw looks swollen. And sure enough, her whole side of her face was swollen, and we saw like 2 little places right there on her chin. And then it made us worry that she was snake bit. So we loaded her up. We took her to the vet. Our vet that's the closest to us that we use, they see patients from 8 to 12 on Saturdays, walk in until they meet their limit. And we just so happened we made it right at the end, and they stopped taking anybody else after us. But they saw the little puppy. They gave her a steroid shot, an antibiotic shot. So we don't know if it was a snake bite or if it was just a bee sting. But by the end of the evening, Saturday evening, she already was looking better. And she, by the next morning, all the swelling was gone, and you can't tell anything has ever happened to her. So that's why I said if we didn't have bad luck, we wouldn't have any luck. So while we were sitting in the vet, the reason I told that story is we were sitting in the vet, and we saw a man come in the back door to the reception, and he had 2 bottles of valbasin. And Eric and I looked at each other like, where did they get that? So we asked them. I think they had another farmer that had it on hand and had not used any of it and was actually selling it back to the vet. But we lucked out. We got a couple of bottles, and so we have that here if we need to use it to treat. So I treated her with valbasin and Sidectin. So hopefully we'll see a difference in a few days, and that swelling will go back down and she'll get better. But she's eating, drinking fine, you know. But the other little buddy was too. So I know it's just one of those things. But yeah, that's what I wanted to come on here and share with everybody, and wanted to tell y'all what was going on our farm and kind of give y'all a little warning and what to look for in the case of anemia and bottle jaw. So stay tuned, and we appreciate everybody who supports us. Until next time, I'm Amber from A&E Family Farm. Thanks for watching, guys.